Thank you, Selma. So just a point of correction, I'm not a doctor yet, I'm a PhD candidate.
You're almost.
Yeah, okay. Thank you for inviting me. So last week, I had a call from Selma. She wanted to make sure that I know what I was supposed to do today. So this is not a lecture. She asked me to make this as interactive as possible. So you're going to be doing exercises. You're going to help me with my presentation. So to start off, I'm going the wrong way. Okay, so our learning objectives for this lecture would be for us to understand what mental health is. I think in the past 3 or so days, we've been talking about mental health, but no one has really come up and said what mental health was. So we also want to look at common risk factors and some of the common mental health problems that we have, especially in adolescents, give a global picture, but also zoom in into Africa and some of the countries that are going to be represented here. And we also want to look at interventions that are available and also the digital platforms that young people can use. And then at the end, we have call to action. Okay, so for the exercise, I would like you to, I think everyone has somewhere to write, a pencil, a pen. I would like you to draw. The first thing that comes to your mind when you think about mental health. So I want us to be as honest as possible. The first thing that comes to your mind. Yeah, so we have just 1 minute to draw this.
Draw, right?
Draw.
I need a pen.
So we're also testing your artistic abilities. I'll ask just 2 or 3 people to share their drawings with us. But because I'm going to randomly pick, I want everyone to draw what comes to their mind when they think about mental health. Okay. Do we have volunteers to share? Yeah, we've got one at the back. Yes, you can stand up and share.
Okay, so I'm not good with drawing, by the way, but these little soldiers inside, I could say, depressed, by the way, for instance, like stress.
Okay,
yeah.
All right.
So, yeah.
Thank you. There's one there.
Thank you. I drew 3 overlapping circles. And for me, these 3 overlapping circles show the mind, the body, and the support system all overlapping. Thank you.
Okay. Thank you. Yes?
I've drawn something like this.
Can we see those who are near her?
What is it?
There are different circles that don't have any sense of direction. So it describes different things running in your mind.
Okay. All right. I think those are very good examples of what we think about when you think about mental health. I think we've got one last one there.
I see this person with the head bent down, wrinkled face, and the hand is on the head. Yeah.
Okay. All right. I think let's clap hands for ourselves. Thank you very much for those descriptions. I think we can tell that when most people, when they think about mental health, they go to the worst case scenario. We have that picture of a person probably in the streets eating out of the dustbin, and they have tattered clothes, and they haven't been bathing for a long time. That's the picture that we have. So now I want us to just focus on what the World Health Organization says about mental health. Okay. Right. Okay, so the definition from the WHO that I really like says that mental health is a state of mental well-being that enables people to cope with stresses of life, realize their abilities, learn well and work well, and contribute to their community. So I want us to pause again there and just think about this definition. How many of us would honestly say that they are coping with their stresses of life? By show of hand.
Can you have levels?
Yeah. Okay. How many of us would say they're realizing their abilities?
I can say that.
Some days. Okay. And learning well and working well? Those who are working, we're happy with our paycheck at the end of the month. And contributing to our communities. How many of us would honestly say we are? Yeah. Okay. All right. So I want to highlight there that if we are to go by the definition by the WHO on what mental health is, we can see that all of us here are affected in some way. So we are not wearing tattered clothes. We don't have, unkempt hair. We are not eating out of the dustbin. But we're just, trying to cope with our normal stresses of life, trying to realize our abilities, trying to learn and work well and contribute to our communities. So mental health is important for us to talk about every day, just like we talk about physical health. So going on to some of the risk factors that I see when I work with young people. Young people talk about stress a lot.
Next slide.
Next slide, maybe. Okay. The big one. Okay. Yeah, they talk about stress a lot when they think about mental health. And I think talking about stress is an easier way to address mental health topics, especially in the young generations. So when we talk about stress, let's just reflect on some of our stresses that we have, like our workload, illnesses that we might have, financial stress. If you come from Zimbabwe, yes, this is a big one. Lack of sleep, deadlines at work, at school, conflict, anxiety, and other things. So I want you to imagine that you had a bucket of stress where you pour all of these stresses into. We have to have coping strategies in order for us to cope. Because if all of these demands that we have from our normal life are poured into this stress bucket and there is no release, then this bucket overflows. So a lot of times when I talk to young people, they like this illustration because they can relate with some of the stresses that they're having in life, which might contribute to common mental problems. So as we know about stress, I don't know if that is visible, we have good stress that will keep you alert and, make you problem solve quickly, etc. And we also have bad stress, which in young people usually is seen as anger, frustration, and, negative body reactions. If we don't take care of our negative stress, then this is one of the risk factors to common mental problems that we have, especially in young people. So we often talk about stress and highlight how that might cause other problems, but we never really focus on stress and highlight how that might cause common mental problems like depression, anxiety, and others. But I don't want us to think about stress as the only risk factor. I highlight stress a lot because this is relatable to young people, and it's close to what feels like depression and anxiety. There are other causes of mental health problems that could be biological, or psychological, and social. So in the HIV context, there are many common mental problems that we deal with. But I just want us to have a global picture of what common mental problems in young people look like. So we've had from many speakers before of the statistics, but 20% of adolescents between the ages of 10 to 19 have a non-psychiatric condition. And the most common ones would be depression and anxiety. At least 23 million children and adolescents have depression. And as the previous speaker said, most of the common mental problems will have an onset on the second decade of life. So this is where the adolescents start. And depression is one of the leading causes of disability globally. More girls than boys are affected by depression and anxiety, and 2 to 3 times, depression and anxiety is 2 to 3 times more likely to happen in young people living with HIV than the general population. And we know that 80% of the disease burden of depression especially would be in our regions, where at least 90% of young people reside. Other problems that we usually focus on, especially in the HIV context, would be stress and trauma-related common mental problems. And when we talk about trauma-related, we worry about post-traumatic stress disorder. That's another mental health problem that we have. And all of these mental health problems that I have mentioned, depression, anxiety, post-traumatic stress, are usually associated with self-harm and suicide. And we know now that suicide is the third leading cause of death in the age group of 15 to 24. And then we also have other mental health conditions such as generalized anxiety disorder, and we have anxiety attacks, panic disorder, social anxiety disorder. So I want us to reflect on this slide and just think about anxiety. Anxiety usually comes when you're worrying about something. And in the context of HIV, there's so many areas where a young person might get worried and worry about the worry all the time. For example, when someone is told for the first time that they might be HIV positive. And again, with anxiety, I just wanted us to reflect on this slide because anxiety is usually misunderstood and sometimes mistaken for other things that I explained, especially in the African cultures. So when someone has anxiety attacks, what do we say they have in our African countries? What do we say? They have a spiritual attack. Yeah? Or they have a bad spirit upon them. So, going to a psychologist or going to seek help from a healthcare professional might not be the first point of call. They might be taken to a traditional healer or a spiritual father who might have to pray the spirit out. But because of some of the things that might happen during these interventions, it might cause more anxiety. So the problem keeps going on and on. Okay, so what do we do now that we have at least an idea of some of the common mental problems that we have? We have screening tools that can be self-administered. And these tools are available on the internet. You can Google these and you can find them. I wanted to highlight a few that have been highly validated for use in Africa. The first one is the life event checklist. And this is a checklist that goes through different traumatic or stressful life events. And if you tick that you've gone through, it could be sexual abuse, physical abuse, and others, we then worry that that might lead to post-traumatic stress disorder. So there's another checklist that is self-administered as well and readily available that is called the post-traumatic stress disorder checklist. And this now then assesses for post-traumatic stress. And then we've got the impact of events. Again, it's also stress-related, trauma-related. The PHQ-9, which you might be familiar with, the Patient Health Questionnaire, is for depression. And we also have another one specific for adolescents. So the Patient Health Questionnaire for adolescents. And we also have the Generalized Anxiety Disorder Scale, the GAD-7, that you might also be familiar with. So these self-administered screening tools are available and can be used. But here I would encourage people to use them, and when you feel like you might have, or you're ticking most of the symptoms on the questionnaire, seek help. These are not diagnostic tools, they're just screening tools that will help a healthcare worker help you. So if you feel like you've gone through a self-administered tool on the internet or a hard copy, and you feel that you might have one of these problems, please seek help. Okay, for psychological interventions that we have, I think we can all agree from literature that cognitive behavioral therapy has been highly adapted for use in Africa. This is because it's an evidence-based intervention that is shown to work for depression, anxiety, and other common mental problems. And I wanted to highlight Life Steps. Life Steps is specific for ART adherence, for ART adherence. And it looks at some of the issues or barriers that young people might have when it comes to taking their medication. It helps people to problem solve around barriers that have to do with taking your medication specifically. And then problem-solving therapy. Problem-solving therapy would be the one that has been used by the Friendship Bench. You can see the Friendship Bench in the corner. And it also focuses on just highlighting what problems a young person might have, and after highlighting the problems, helping you to define the problems and helping you to come up with solutions for those problems that you can find solutions for. But there's some problems that would need to be managed. Okay. So there's also trauma-informed cognitive behavioral therapy that we are currently adapting, and it's in the stages of an RCT now in Zimbabwe. And this is a group peer-led, trauma-informed therapy for young people living with HIV between the ages of 10 to 19. And then we have mindfulness. I would have wanted Dr. N to lead us into a mindfulness exercise before I finish, but I'm told that I've run out of time. And interpersonal therapy, I think, which was highlighted by presenters yesterday. So those would be some of the interventions that we have that can be used in Africa. And then we also have digital platforms like Vimbo. This is an app that is proven to be capable of reducing common mental symptoms of depression and anxiety. And I think it has been adapted in South Africa, and we are now going to adapt it in Zimbabwe. But there are also other digital platforms that have been highlighted in the last 2 days. Okay, so call to action for me. There's so many evidence-based interventions out there that can be used in mental health. I want us to be able to get to a place where we are culturally and contextually adapting these interventions and making use of them in our communities. We need to include young people. I think this has been the buzz phrase. Let's include young people. They are the experts by experience. And all of these interventions and everything that we're trying to do, even in mental health, has to be human-centered, and we need to co-produce interventions with young people. We also want to integrate mental health into already existing systems, because mental health does not exactly attract lots of funding. Let's also have interventions that would include stress and trauma. And let's not talk. I think I always go to many conferences and congresses where we talk about mental health, but no implementation is done. So let's implement interventions for young people especially. To end my presentation, I would like to leave you with these Shona words, which mean deeds, not words. Let's implement, let's have more deeds, not words. And in Shona we say, Zviito, kwete mashoko. Thank you.